Engage Consult is an online patient-to-doctor non-emergency engagement platform that helps practices enhance efficiencies and boost patient access. It allows patients to communicate securely and safely online with their practice about their non-emergency medical conditions, admin questions, or online video consultations. It also offers 24/7 access to symptom-specific help, information, and easy access to other local NHS and self-care services. It's designed to boost patient access, enhance practice efficiencies, and free up much needed time and resources for clinical and admin teams. It can be used as a single practice or part of a wider network to help manage demand more efficiently. Patients can access the service via the NHS app or via the patient portal, which will be a link on your website. They can select a service such as a medical consultation, admin query, or upload health data, and you can also add signposts and links as well to this page to signpost patients off to other services. This is completely configurable by the organisation to make sure it suits your business needs. Patients will go through, select the service they need, answer the relevant questions to their condition. If they're typing in a medical problem, they will also be shown self-help links and any alerts to do with that medical problem to make sure it's appropriate for the service. And they can upload any pictures and files to those requests as well. Once they've been sent through, that will then be sent to the practice to deal with. You can also see they can receive messages into their account and respond to the practice any requests that might have came through. And they've got a log of what they've sent through. We are integrated with EMIS Web, System 1 and Vision. And once those requests come into the practice, it comes into the engaged client, which is shown on my screen. This is integrated with your clinical system, and this is where you receive the requests from the patients. When these requests come in, you can filter those requests and order by to ensure you see the requests you need to see. But also we have intelligent request routing, so you can set up rules to get those requests to where they need to be. So for example, we've received a new request for a rash. We can see the patient's information, who the patient wants help from, and which group this is currently sitting in. So we can intelligently route this request straight across to the doctors without any manual intervention needed. So this saves a lot of administration time in manually assigning those requests across to the appropriate group or colleague. You can see on my screen an example of these rules, so you can do it by system defined rules, so more general, admin request to the admin group for example, or you can route particular medical conditions such as diabetes to the diabetes team. When you're dealing with that particular request from the patient, there's many actions you can do on this, so you can contact the patient by two-way messaging, message the patient using a message template, add any attachments, now that can be from your computer or from the patient's record, and send over that message to the patient for them to then respond to. So you can gain back valuable information and any pictures or documents you may need, but also send those across as well to the patient. You can start a video consultation with that patient, and you can have multiple participants on the call. You can send yourself the link by SMS, and also that codes into the clinical system if that patient attended or did not attend. You can action this request, so assign to another group or colleague, so it's nice and easy to get those requests to where they need to be inside the practice, but also this can be used if you're collaborating with another organisation or within your PCM for example. You can assign these requests across to other organisations as well, so it doesn't just have to be internal. You can add a note to this request, and then once you've actioned this request you can send it to the clinical system. So you can upload it to the clinical system as structured data or as a PDF, which is shown on my screen an example of one we have sent previously. This is SNOMED coded as an online consultation, but if they've answered any particular questionnaires such as asthma control test, PHQ-9, GAD-7 or an asthma review, it will be SNOMED coded directly into the clinical system. We also have our toolbar, so you can easily keep an eye on those requests coming into the engaged client, so any unread requests from patients. And you've got certain actions as well you can complete from this particular toolbar. So you can create a request on behalf of a patient. So let's say if a patient was phoning into the surgery and you needed to create a request on their behalf, it's nice and easy to get that request into the engaged client. As a receptionist, for example, I can go through and create that request on their behalf. If a patient has initiated contact but you need to initiate contact, you can go through and send them an outbound patient message. Now this can be by SMS or engage message, and you can upload questionnaires to that particular message. So we have questionnaires already there for you, such as asthma control test, PHQ-9, GAD-7, but we also have medication reviews, ethnicity, epilepsy review, for example. You can upload and they'll be SNOMED coded into the clinical system. You can schedule those messages, set reminders, and also choose where that response will come into so it gets to the right person straight away. Again, when you send these messages by email or SMS, it'll be SNOMED coded into the clinical system that you've sent the message and the message you've sent. But let's say you're sending a bulk message and it's a general communication message about your surgery. You can choose not to include that bulk message into the patient's record so it doesn't clutter up the patient's record. We then have our back of house management console. So in here you can edit your settings and set it so it works for your organisation. So you get to choose how those requests appear in the patient record. You've got complete control over your demand management settings, so you can choose the start time and end time for each day and the request limits for each day, but also you'll see that's separated for medical and admin, so you can have separate times and request limits for each of those routes through for the patient. You can also choose if you allow users to send requests outside of service hours or not, and at any time you can come in and update these settings. You can also choose the questionnaire that the patient answers when they're sending through a medical complaint. So for example, you can use either the i/custom questions, which is a set of simple questions requiring a free text response. So depending on what the patient chooses as they go through when selecting a medical consultation, you can choose which questions they answer, if they're required, if they're optional, and you can go in and customize these questions as well. So the same question set will be displayed to each patient sending through a medical complaint. Or you can use our advanced questionnaires, so that's based on the problem entered by a user. So it uses the instant medical history questionnaires with branch and logic. So if I type in rash, for example, I'll get a questionnaire around my rash with multi-choice. That's just a few of our features that I've gone through today. There's lots more you can do with the system. To book a demo, please email sales@engagehealth.uk so we can show you a more in-depth version of the system.